Ah, yes, please, please, come in, come in. Make yourself comfortable. An energy drink, perhaps, or some Takis.
Well, thank you so much, Doctor. I'm so excited to be here. I really do appreciate you fitting me in on such short notice.
Yes, well, here at the GitGudenburg Institute for Gamer Therapy, we are usually booked up for many months in advance, mostly with wild players, and of course, many of the community team have their regular weekly appointments as well. We have also been treating a couple of developers for many years.
Devs come here? But what kind of problems could they have?
I am not at liberty to discuss the details, but let us just say that daddy issues can be very traumatic.
I just want to say how wonderful it is to finally meet the world-famous Dr. A. GitGudenburg.
Well, thank you, but no need to be so formal. Feel free to call me just A guy.
Sure, Doctor. Just A guy it is.
Yes, well, it's very nice to meet you, Mr.
Nubian? Larry Nubian. But my gamer tag is Flung Poo Panda.
Of course it is. Now, Mr. Nubian, what brings you in to see me today?
Well, Doctor, it's a lot of things, but mostly it's just I'm not happy.
Ah, yes, well, my notes here say that you are a priest main, so that's perfectly normal.
But it's not just that. I feel so stressed out and anxious all the time.
Can you give me an example?
Sure. So just a few weeks ago, I was really nervous just thinking about the upcoming Voyage to the Sunken City expansion set, and it looked so amazing and so wet. And well, I just wasn't ready. And it happened too quickly, and I didn't enjoy it.
Ah, well, what exactly happened?
Well, the pre-release caught me by surprise. Then before I was ready came the expansion, and then suddenly there were streams going everywhere. It was just overwhelming.
Yes, I see. Well, gaming-related anxiety is not uncommon.
Well, that's how I feel all the time. And after how unsatisfying it was, I just don't even look forward to them anymore.
Yes, Mr. Nubian. There are many factors that can contribute to this feeling, such as fatigue and distraction, your obvious advancing age, and poor physical conditioning. What you need to keep in mind is that worrying about it will only make it worse.
Well, what do you suggest, Doctor?
You need to try to relax and focus. I know it seems like it happens too quickly, but it doesn't have to last a long time for you to still enjoy it.
I think I understand. But it's not easy, though, especially when I start hearing the voices.
You are hearing voices?
Yes, cruel voices that ridicule and mock me all the time.
What exactly are these voices like?
Well, it's a man's voice, and when I'm losing badly, he mocks me by saying the most awful things, like, "I'm rooting for you," and "You can turn this around." And even worse, "I think you could win this whole thing." Unrelenting mocking. When I'm at my lowest, I don't know if I can take it anymore.
Yes, well, this is certainly a concern, but perhaps you can try to see these voices as encouraging instead of mocking. Or if not, perhaps turn the volume down to not hear them at all.
But Doctor, I play with the volume off to start with.
Oh, well then, this could be a bit worse than I first thought. We might need to consider medication. I would like to run a brief test to see if we can dig a bit deeper into your subconscious.
I suppose, sure.
I am going to show you a few images, and I would like you to simply say the first thing that comes to mind, all right? Just tell me what you see here.
Well, that picture looks like a dev openly mocking the community.
Very interesting. What about this one?
Well, that's obviously upcoming patch notes that don't properly address any of the real balance issues.
Oh, my. And the last one?
That looks like the community team giving a card reveal to someone who really doesn't deserve it.
Fascinating. Although I am sure that has never actually happened. Mr. Nubian, you seem to have many deep seated issues that you are dealing with.
Well, I have been playing since beta.
This explains much. Mr. Nubian, I am sorry, but it appears our time is up for today. I believe we will need to be scheduling several additional appointments to properly treat you. As far as billing goes, will you be paying in gold or dust?
Oh, do you accept mercenary coins?
Not a chance. You may make arrangements and schedule your next appointment with my receptionist on the way out.
Well, thank you, Doctor. I must be one of your worst cases.
Not at all, Mr. Nubian. We treat many patients who play Artifact.